Welcome to Perspectives, a special presentation of the Power of the Patient Project. Today's guest is Dr. Lori Ryland. And now, here is your host, Charlotte Grinnell.
Hi, I'm Charlotte Grinnell, and welcome to Perspectives presented by the Power of the Patient Project. My guest today is Dr. Lori Ryland, Chief Clinical Officer of Pinnacle Treatment Centers, headquartered in Mount Laurel, New Jersey. She is the 2017 Outstanding Alumni Award recipient for the WMU College of Health and Human Services for her contributions in the field of addiction treatment. She received her PhD from Western Michigan University in clinical psychology and completed the specialist program in alcohol and drug abuse. She is a board-certified behavior analyst and a certified advanced alcohol and drug counselor and supervisor. Dr. Ryland has a broad scope of 20-plus years of healthcare experience, including work with veterans with PTSD, inpatient psychiatric, addiction treatment, criminal justice, autism treatment, serious and persistent mental illness, intellectual and developmental disabilities, traditional outpatient services, and psychological testing. Today, she'll be sharing her experience on several issues related to mental health as the pandemic continues. Welcome, Dr. Ryland. Thank you so much for joining us today to discuss this important topic.
Thank you, Charlotte. I appreciate you.
Yeah, so first, could you start out with explaining the mission of Pinnacle Treatment Centers and their approach to the healing process?
Absolutely. So at Pinnacle Treatment Centers, we treat addiction issues. And our goal is to make sure that we're providing effective treatment services for individuals struggling with addiction and their families in order to allow them to find a life of recovery and a life that is meaningful for them and consistently allows them to follow their own values.
Perfect. And so the coronavirus pandemic has been, an uncertain, isolating time for so many people. And so clearly this year has compromised mental health for many people and continues to do so. What advice would you offer to those who are feeling lonely and depressed right now, as well as continue to cope with the pandemic?
So this has been a really tough year for even individuals who are healthy and well. I mean, it has been a struggle and it has been very stressful. I mean, and I can understand both sides of the concerns. I mean, we have individuals who are consistently fearful of being in contact with the illness, of acquiring the illness, concerned for their family members. And then we have others who are really concerned about the lockdowns and concerned about the economy and the unemployment rates. So, I mean, there are so many different issues to be concerned about that are brought about by the issues associated with the pandemic. So, for those who are really struggling right now, or who are working with people who are struggling right now, there are a couple of things to keep in mind. So, if you're working with clients or patients, trying to have them work on being more mindful and present in today, right? Because as a psychologist, one thing we work on a lot is trying to live through this moment and not get wrapped up in fears or shame about the past or not fears and concerns about the future, because often this moment's okay, right? The moment that we're living in right now is usually not the problem. Usually it's concern about what might happen, or, is my family member going to get sick, or, what is going to happen with the economy. So trying to focus on where you are right now and use mindfulness activities to be present can be extremely helpful, not just for those that you treat, but for yourself, if you're struggling as well, or you're someone who is struggling. Some of the different mindfulness practices can be, focusing on practicing meditation. If you haven't done anything like that before, you can easily Google it, go on YouTube, find some examples, start to practice. It can be prayer, it can be focusing on the breath, it can be yoga. There's so many different ways that you can focus on being more present. So that's one. Another example that I recommend is to look at your thinking patterns. We use a treatment modality called cognitive behavior therapy. And part of that is becoming more aware of some of the stories that we tell ourselves on a day-to-day basis. If you find yourself, getting really wrapped up in reading the news every day, having a lot of thoughts about what could happen, this is terrible, this is not going to be okay, what am I going to do? That type of thinking can perpetuate and kind of build upon itself and then lead to some stress and anxiety and depression. So being mindful of thoughts, trying to notice if your thinking is becoming really negative, and to try to identify what's actually happening and how to become a little bit more realistic and focused can be really helpful. Since many of us have been restricted in going out into the community and doing things that we normally liked to do, if it may have been, meeting someone for dinner or doing social events, those have been really difficult to participate in. So trying to find other ways to remain connected to your social group or your friends is really, really important, especially now. So sometimes making it a point to either send an email or call someone, text. I've been setting up, almost like Zoom dates with my friends, where we can, just see each other face to face, have a meal, and talk to each other even remotely can make a huge difference. And, before we know it, we're laughing and we're, trying to, talk about hopefully when we can spend some more time together. So maintaining those social connections can be really important as well. I also wanted to note one last thing as far as tips. And that is try to find a way to remain as physically active as you can. Get outside if you can, even if it's just for a few moments. I mean, right here, I'm in the middle of a snowstorm. so bundle up if you need to, but try to find, as much time as you can to be outside rather than, remaining in a cooped up, house and not going out there for fresh air and activity.
Yeah, definitely. I think that those tips are so useful it can be applied to like so many different scenarios, but especially right now when everything feels so heavy and uncertain. When you were saying kind of, noticing your negative thoughts and seeing the stories you're telling yourself, would you recommend that it would be helpful to, journal and write down kind of some of the
Absolutely. Absolutely. Journaling can be a very helpful activity. There are a lot of different activities that have merit in their own way. So journaling can help you put down on paper, some of the things you're concerned about and find out what areas that you're concerned about are completely out of your control and try to let those go. And which you actually do have some control. Like if you're missing friends and family, setting up time to contact them and put it on your to-do list. So journaling can be helpful. Something as simple as revisiting things that you used to enjoy or taking up a new hobby, like knitting or putting jigsaw puzzles together, or something that can be a healthy distraction for the moment that can occupy your mind and give you a break, from some of the stress that is so prevalent right now.
Yeah, definitely. And it's kind of amazing to see all the resources online for these type of things, whether it's what you were talking about earlier, mindfulness or online yoga classes. And there's so many free options for things to do to help yourself, which I think that
Absolutely.
a lot of people are either they're coming out more or people are just now discovering all these things that have been out there. So it's definitely really helpful.
Exactly.
And so you work also directly with patients with addictions. How has the current situation affected these patients?
Well, the changes that we've experienced, that we've all experienced, are impacting individuals who are struggling with addiction as well. So what does that mean? Children are at home, right? I mean, we have some schools are remote, some are back in school, some are doing a hybrid model. But, we early on had children that would normally be in school during the day at home. So parents who, parents are trying to juggle not only child expectations and needs, but also employment needs if they're lucky enough to still have employment. They're lucky enough to still have employment. We have a lot of unemployment going on right now, especially in some specific industries like, the restaurant industry, entertainment industry. We see a lot of unemployment and joblessness. Or, someone may have had a lucrative career, but had to leave that in order to either take care of their elderly parents or take care of their children who have been at home. So, the stresses of all of that juggling has affected not just society, but those who are struggling with addiction as well. So some of the things that we've noticed has been that kind of a shift in our admission patterns. So our organization at Pinnacle Treatment Centers treats pretty much the full continuum of care in addiction treatment. So we have facilities that provide medication-assisted treatment or opioid treatment programs. We have residential treatment, detox programs. We have outpatient programs. So we have noticed that mothers who used to come into addiction treatment residential, they don't want to come in residential anymore. So we're needing to find ways to provide more outpatient services and support for females because they're home with their children generally. So we're seeing that trend and have been definitely taking advantage of some of the allowances granted for telehealth and how we've been able to provide more treatment in a telehealth manner. We have adjusted some of our practices for medication-assisted treatment so that we can continue to provide dosing in a safe manner, increase in take-home doses, as well as increasing other models like car dosing, like trying to make sure that we keep people in their vehicles, that we don't have lines of people, they're waiting for their medications. So those are some of the factors we've noticed. We've had, luckily, we've had relatively few COVID positive cases. We have had them because we're a large organization. We treat upwards of about 30,000 patients a day in 8 states. So, we have a lot of treatment programs. But when we have had positive cases come up, we've either been able to very quickly quarantine and provide support through telehealth, or in some instances, we've been able to use one of our recovery houses as a quarantine and having other patients who are not acute but are positive to receive treatment in a telehealth manner and not be in the regular community. And this actually has worked out fairly well. And when we talk with the patients, many times when they have a positive result, a positive COVID result from a test, their instinct is to, okay, I'm going to go home. And we're like, okay, well, that's your choice. However, you're going home to your family, right? And after talking with them, many will say, I feel okay. I think I'm going to go ahead and just stay here and not go home where I might infect my family or my community. And the health departments and payers have been like, okay, if you have the means to quarantine them and provide the additional care and oversight like nursing, please do that. So we've been able to provide some additional support during the pandemic that has had a very positive result. So those are some of the nuances that we've noticed with the pandemic. We also, as an organization, we have not seen a significant decline in admissions. In fact, we have had some patients that can't receive treatment at other providers they normally would have gone to, so they're seeking our services for the first time. So we have been working, tirelessly together to try to make sure that we can continue to provide effective services to those who need in the communities that we serve. Overall, individuals who don't find themselves in treatment, we have a significant increase in relapse, overdose rates, even suicide rates in the general population have gone up. Domestic violence rates, child abuse rates. When you look at the statistics of the general population, I'm not talking specific to addiction, but I'm sure that it's prevalent across the board. We're seeing people are really struggling out there.
Yeah, wow. That's really great that you guys are able to provide that for them to quarantine and give that support because, yeah, I think that it would be kind of difficult for them to know that they're positive and then go home to their family. So that's really great that
Right.
you provide that. So finally, I know that I was wondering if I could get your insight on this major issue in our country that there is such a stigma attached to, mental illness. And in your opinion, what do you think could be done about it? And how can people, recognize help and to accept it, and more importantly, find the help that they need?
That is a really good question. And I think that we've come a long way in the past 20 years that I've been doing this work. I think that we have a ways to go.
Yeah.
I think early on, especially in the addiction field, more so than mental health, but also in mental health. In the addiction field 20 years ago, there was a much higher issue with involvement in the criminal justice system. So addictive behavior was seen as a criminal behavior, right? So the shift for addictive disorders and being seen more as, a condition that's treatable, that is something that can be chronic and relapsing and difficult, but can be assisted, especially in medication-assisted treatment and effective therapeutic treatment modalities. So addiction in and of itself, we've seen a very positive trend toward incarceration 20 plus years ago to more avenues for treatment today. Now, it's still the case that having an addictive disorder is not seen as the same as having something like diabetes, right? I think there's this stigma where individuals say, well, it's a choice, right? Just stop choosing that behavior and you won't have the problem. And it's so much more complicated than that. And there are so many different variables that impact whether or not someone becomes addicted. We have genetic variabilities, we have developmental history, we have the biology of addiction in and of itself, how substances affect the brain and hijack the brain, and then the brain becomes normalized to substances and chemicals and things that normally might have resulted in pleasure in life, like going to the park with your kids. Your brain doesn't respond the way it did before. Your brain is looking for that significant explosion of dopamine and serotonin activity that it's not getting anymore. So you see some very real changes in brain chemistry as a result of addiction that need to be taken into consideration. So I know the question wasn't necessarily related to that, but it's important to educate the community in how does addiction work and how does one become addicted, so that we can help increase the understanding of addiction. Now, mental illness is also something that stigma has been a struggle. There is a stigma that individuals with mental illness are more dangerous, or more less reliable, or there are very different perceptions around someone with a behavioral health condition. So helping to not only tell the story when you're speaking to others about the struggles that individuals have with certain conditions, just like you'd say, okay, here are the things that someone struggles with if they have a chronic heart condition, right? But also to help people understand that's not the whole story. The whole story includes recovery stories and information about how individuals with mental illness, it's extremely prevalent in our society. It is likely that any one of us will have an episode of depression in our lives, or an episode of anxiety or struggle with a mental health concern or disorder. So it's very common, understanding that the prevalence rates and fighting some of the stigma that's associated with those conditions is really important. So education, looking out for where we notice those inconsistencies or errors in thinking, and addressing them out loud. So if you notice someone that you're talking to makes a statement that is perpetuating stigma, being willing to step up and say, you know what, actually, I don't know that that's quite right. And, correcting some of that misinformation as we go along is really, really important.
Definitely. And I think that, what people see in the media, there's been a positive shift, I think, in, the portrayal of mental illness, but it's still, there's so many misrepresentations of it out there. And so I think just having that in mind when you're watching or reading something, that it's not going to be 100% accurate and could be very inaccurate, and just kind of having that in mind.
Right. And, the part I still struggle with, to be honest with you, as a professional, is how stigma still affects the insurance industry, and how we get authorization for treatment. We see denial reasons pop up that you'd never see for someone who has had a heart attack. I mean, you'd never see, an insurance company say, you know what, I'm going to deny any further treatment for this heart condition because they didn't follow their doctor's recommendations the first time. It's not going to happen. I mean, it's laughable, right? However, we consistently see lack of parity that we work on as an industry as well. When someone has been in a treatment center twice, then we might hear, hey, we're not going to pay again because they should have got it right the first time. And this is just as chronic as any other health condition, and mental health issues as well. We need to understand that there are differences in not just chronicity, but prognosis. And with any type of behavioral health disorder, someone might have situations that arise again that put them in an acute situation, and they require adequate and effective treatment when that happens. Regardless of the effective treatment, we need to be prepared to respond and address those urgent needs when they come up.
Yeah, definitely. And thank you so much for this conversation, just especially at this time. I think it's so needed to know these healthy coping mechanisms and to keep all this in mind. So thank you so much for taking the time out of your day to do this.
Of course.
To spread this information.
Of course, anytime. Thank you, Charlotte. I hope you have a great night.
Yeah, you too. Thank you so much.
Thanks. Bye-bye.
Bye.